Happy Friday, everybody. One of the things that I've been reading about lately is umbilical artery Dopplers, or use of Dopplers in general. So what is a Doppler? It's where we look at the blood flow in a vessel. And this specifically what I'm talking about is, a baby has the cord, right? And in the cord, there's two arteries and one vein. And we'll actually use a certain setting. And it's usually, you hear that heart rate is what most people think of. And we can measure looking at the waves from the peak of systole, so when the heart is pumping the highest, all the way to the bottom of diastole. And that's about as advanced as we've gotten with that Doppler flow, which is kind of ironic, is comparing those differences in different ways. And so there's different ratios that we use. And that is definitely 100% useful in growth-restricted fetuses in the United States if your baby is measuring less than the 9th percent or the belly is less than the 9th percentile. Or equal to, then we're gonna say that your baby has growth restriction, and we're gonna definitely be doing Dopplers to look for that blood flow. So we're looking to make sure that the blood is not having more resistance, and that would be an elevated Doppler. And also we're looking to make sure that at the end of the heart filling, right, diastole, that the blood is not either stopping or going the wrong way. So that's either absent or reverse in diastolic flow. And so those are kind of the things that we're looking at in those situations. In the world, Dopplers are used a lot more, mostly for like placental health evaluation. And I would say that that's something that a lot of people do as well. And so it's controversial as to when you can use it outside of growth restriction. But that's the kind of the thought behind it, right? Is because you're looking at that placental flow compared to the fetal heart rate. I had an awesome day hanging out and teaching today. So I'm going to continue my learning, but thank you guys, and I hope you're having a great week.